Hello everyone, for today's faculty development series, I'd like to share with you a tool that I use to intercede when trainees are struggling with difficult conversations. This talk will cover the following clinician educator competencies of learner assessment, feedback, and learner professional development. The problem I want to highlight today is, what do we do when a trainee is communicating poorly with a patient or a family and is not asking for help? Oftentimes when I'm in these situations, I have found that my discomfort will build and build and build to a particular threshold, and then at some point I'll decide enough is enough and then intervene. The challenges that I have in these situations are it's difficult to know when to step in, and it's also difficult to know how to do that effectively. Stepping in too soon can undermine the learner's confidence, it undermines the patient and family's confidence in the learner, can create a sense of discouragement, and result in missed learning opportunities. If we jump in too late, it can cause confusion or unintended outcomes. And if we intervene too frequently, it can make the trainee hesitant to speak further. So the tool I'd like to share with you is actually a phrase, which is, "May I add something?" This is what I'll use once I've identified when it's an appropriate time to intervene. Now the reason why I find the phrasing of "may I add something" to be effective is because that one, it signals collaboration in the sense that it sets things up so that we're not contradicting our trainee, but rather adding something on to what they've already shared. Secondly, it allows the trainee to maintain ownership of the conversation because the flexibility within this phrasing is that you can then pass things back once you've added your point. And third, it's a non-threatening way of modeling effective communication. Now the next thing I'd like to do is to highlight a handful of scenarios in which you might utilize this tool to intervene, and to also give you some additional scripting on ways that you might pivot the conversation in the direction that you would like. So the first is when you perceive that a learner is actually providing misinformation. And so in this instance, "May I add something here?" Just to clarify. Another scenario might be when you perceive that there's been a missed emotional cue that the trainee did not pick up on. And so you might then say, "I noticed a reaction. May we check in on that?" Another example is when the discussion is resulting in an escalating conflict, whether in between patients and family members or between the patient and the medical team. And this is a spot where you say, "May I add something? Let's pause and reset." When the explanation or discussion is getting excessively complex, when there's a laundry list of things being shared, you might then say, "That was a lot. To summarize." And then lastly, if the discussion is dragging on, but there are very time-sensitive matters that you would like to discuss, you might say, "May I add something here? Let's make sure that we have time for next steps." As I mentioned earlier, an advantage of this particular phrasing is that it allows the metaphorical baton to be passed back. Once the preceptor has made their point, control of the encounter can be given back to the learner. I'll let Dr. So-and-so continue sharing the plan with you. And so, in summary, when you perceive that a learner's communication with a patient or family is going poorly, it's important to recognize when to step in, as in the couple of scenarios that we highlighted earlier, and using this tool of "May I add something?" as an effective way of both maintaining a collaborative atmosphere while still giving yourself an opportunity to intercede. These are my references, and thank you for your time.